Good evening, everyone. Myself, Dr. Harita Nath, member of FCPI. On behalf of FCPI, I am honored to welcome you all to today's session on the topic Mixed Method Research, a newer approach in healthcare. Sorry for the delay in starting the session. We had some technical issues. So without further delay, we will move on. So before starting with this session, I would like to give some general guidelines for the participants. So for attending this session, all have to register in the FCPI website. After registering, you can watch our session either through the YouTube channel or else through our website. But please make sure that you have to download your participant certificate immediately after watching the session because it will be available only for a limited time. Regarding the queries, if you're having any queries, you can share in the comment box of YouTube as well as our website. If you are having a more detailed query, you can mail to FCPI prior to the session so that we can discuss it in our webinar. As many of you know, healthcare is a complex arena that requires not just quantitative data, but also qualitative insight to understand and experience the need of patient, healthcare providers, and the system. The integration of qualitative and qualitative data provides a richer narrative enabling us to explore not just the what, but the why behind the healthcare phenomenon. Now, I would like to extend a warm welcome to our esteemed speaker, Dr. Mohammad Rashid sir. He is a postdoctoral research associate at University of Utah College of Pharmacy, Salt Lake City. He completed his PhD in uh, pharmacy practice with a specialization in pharmacoeconomics and evidence synthesis from Manipal University last month. Congratulations, sir. He is expertised in systematic reviews, meta-analysis, and mixed method research. His research interests include critical care, pharmacoepidemiology, pharmacoeconomics, and drug safety. Sir has published more than 50 highly indexed papers in international journal, as well as he has received many travel grants from international and national organizations. So without further ado, I would like to invite Dr. Muhammad Rashid sir to start with the session. Over to you, sir.
Thank you so much, Harida, for such a warm introduction. And thank you, everyone, for waiting us in this session. Sorry, first of all, apologies for a technical glitch in the initial stage. So without a further further delay, I'm just moving to the session. So basically, mixed method research is a newly adopted technique in the research of healthcare, and it have wide varieties of application. So in the coming slides, we'll be discussing all the applications of mixed method research in the healthcare. So moving forward, the mixed method research basically it's a technique, and we might have used during your clinical research, but you may not be aware whether it was a mixed method research which you were using. So basically, it's a technique which will integrate the quantitative research with the qualitative research in a single project. So that is the basic definition of a mixed method research. So you will be doing many quantitative research, like or you will be doing an RCT, or you will be doing any cohort studies, or you will be doing any case control studies, or you will be doing any quantitative research. And this quantitative research you will be combining, or you will be merging with a qualitative research. So in the coming slide, I'll tell you what is a qualitative research. So basically, this will help us to explore all the phenomena. It will help us to explore all the understanding of a topic in detail. So that is where we go with the mixed method research. So obviously, mixed method research is having so much of weightage or more strength compared to the individual study designs. So here, basically, quantitative evidence, like you will be doing a cohort study or an RCT just to see how the drug is effective. I'm just talking in a clinical perspective. So there are multiple approaches, there are multiple objectives to conduct a quantitative study, but I'm talking in a clinical perspective. So when you go a clinical perspective, the quantitative evidence will be applied to see how the drug is used, or you will be checking how the clinical benefit of an intervention, or how the drug is affecting in a bigger population or a small sample size, or you will be just estimating how much that drug is able to take the patients into the improvement or worsening or whatever that. So that is basically call it as quantitative evidence. So in quantitative evidence, you will be measuring something, you will be quantifying something, or you will be estimating something. That is basically quantitative evidence with the use of numerical data using numbers. So that is basically a quantitative research. So the qualitative research is something beyond that. I'm not sure how many of you already have an experience in qualitative research. So basically, in qualitative research, you will not be able to measure something in terms of a numerical quantity. So that is the difference between a quantitative research and a qualitative research. So what do you do in qualitative research? So I know what I'm experiencing. Okay, if you ask me, how was your experience uh, on a particular topic, or how was your experience in research? So I have multiple things to say. You may not be able to, or we may not be able to quantify in numerical data how is his experience, or someone, okay, you are asking a patient, how was your experience after taking this medicine? He will have multiple things to say. You may not be able to quantify how was his experience. Or you ask a expert, how is your perception about a particular topic? So he'll have to tell a lot of things. So in that case, you may not be able to quantify in numbers. Instead, you will be able to understand his or her perception or experience, or how they feel. That is basically you analyze in the qualitative research. So that is the difference between a quantitative research and a qualitative research. So basically, quantitative evidence is a practice based data evidence, and qualitative research is an experience based evidence. So along with that, actually we don't combine literature evidence even here usually, but there are some instance you can integrate this with the literature evidence. So basically, literature evidence, as you all know, it is what the literature says, what is the existing publication says about a topic. So that is basically a literature evidence. So you can do multiple combinations of this. Either you can do a qualitative research first, then go for a quantitative research, or you start a quantitative research first, then go for a qualitative research. So it's up to you. So but there is a where there is a particular situation when you need to use this appropriately. If you are not using this appropriately, you will not be able to generate a proper mixed method research approach. So basically, I'm moving forward. So this is when you combine this, it is called it as mixed method research. So when we do the mixed method research, so when you do the mixed method research, there are multiple things which you need to take care. It should be the credibility, refers to the suggestions that employing both approaches enhance the integrity of the findings. So it's not just combining some studies. No, there should be a credibility for your research question to do a mixed method research. You can't simply do a mixed method research. If the quantitative evidence is good enough to provide the data, you don't have to go for a mixed method research. So there should be a credibility. There should be a genuine reason to go with a mixed method research. Next one is context. There should be some context to use the mixed method research. Like you can't apply the mixed method research into all context. You can't there are some situations where you need to use the mixed method research, where you should not. Then illustration. So you should be able to properly derive how you are going to illustrate your finding, because you have a huge amount of data. You have a huge amount of data from quantitative research. You have data from qualitative research. So you should have a proper way how you are going to illustrate that. Then utility, or improving the usefulness of findings, how much it is good. Then confirm and discover. So there are multiple things when you need to use the mixed method research. Usually mixed method research we in the healthcare use when there is a diversity of views. Diversity of views in the sense, suppose the quantitative evidence is telling that the drug is effective, but the qualitative, the experience of a physician is the drug is not effective. So what happened? There is a diversity in views, or you say that the guidelines says to use this particular set of drugs, but what is happening in the practice, they are not using that particular set of drugs. Why it is? So there is a diversity in the views. So when there is a diversity in the views, you are going to use the mixed method research. So there are some contexts, there are some kind of situations where you use the mixed method research. Okay. So when it comes to the diversity of views, there are multiple things it will help us to achieve. Like it will be able to tell how your knowledge, local knowledge means what you got from a particular setting, is able to extrapolate or integrate with the national or international guidelines or international knowledge. So you can integrate the evidence what you got from a local setting with the international settings or national settings. That is one advantage of a thing. Or you can learn from different perspective. Okay, I did a study in, suppose in Karnataka, but I want to get, this is my finding, but I would like to get the perspective of a expert from a somewhere else, maybe from other part of India. So what I do, I will perform a study in my setting. I'll have my quantitative data. I'll talk with the experts, then I will get his perspective, what he think about my research. So you can do multiple things with the mixed method research. So there are a proper way to do this. Okay, so I'm going further. I'll just give some glimpse, or you can read further. Or if you have any queries, or if you need any further assistance, you can always get back to us. Okay, so what happens here, as I was telling, the quantitative evidence. So what basically we know from the quantitative evidence? So we have multiple methods of quantitative evidence. We have multiple sources of quantitative evidence. You have reviews, overviews, systematic reviews, meta-analysis. You have RCTs, observational studies, surveys, cross-sectional studies, case reports, expert opinion. So these are all different quantitative evidence which is having the numerical data. But what is the problem with this data? Okay, the problem with this data, there is lack of information on the generalizability of the findings. Like you might be seeing that, right? When you perform a study, in the discussion part, you will be telling how you can generalize this result, how it is applicable to the other population. How, suppose you have conducted a study in Karnataka, how it is applicable to the Indian population. So that is the generalizability of the findings. But what happens, many times there is a lack of information on the generalizability of the findings with respect to the quantitative evidence. Or else, suppose I did a meta-analysis. What happens? I got only the studies which are conducted in some part of world. So what happens? What about the other part of world? How it is impacting their evidence, how it is impacting their practice? So there is some limitations to the quantitative evidence with respect to the generalizability of the findings. Other problem, the quantitative evidence always numerical. You may not be able to deeply understand the meanings and explanation. Okay, so I say that the drug is effective. Drug is effective in terms of what? The drug is effective maybe in clinical. How about their perception? How about the feeling of a patient, how he felt after taking the drug? We may not be able to say, we may not be able to get for that from a quantitative evidence. So that is where we apply a qualitative research. So then the implementation plan. Okay, you saying that the particular intervention is effective, how you can implement into the practice without a qualitative evidence or without a mixed method approach? 90% you may not be able to tell that how it is implementable to the practice. Okay, you are saying that you brought a new intervention. Okay, I'm bringing some new clinical interventions. How you are going to implement? Okay, I'm bringing a clinical pharmacy service in my hospital. Okay, I have a huge amount of data. The clinical pharmacy service is effective in terms of improving medication, or in terms of improving ADR or whatever it is. But what happens there? So when you are going to implement that into a practice, when you are going to implement that into your clinic, how it is going to influence the practitioner, how you can implement that into the practice, that is a big question. Without conducting a good qualitative evidence, good qualitative research, you may not be able to tell how it is implementable to the practice. So what you do there, you will be going to the experts, or you will be going to the healthcare professionals who are going to work with you. You'll be taking their inputs, you'll be talking with them, you will be asking them, we are going to implement this set of plans, what is your perception about that, how you feel about that, do you have any suggestions what we can improve in that. So this is basically qualitative research. So what you did, you did a quantitative research, you are able to tell that your pharmacy services are able to improve patient outcome, but after that you are doing a qualitative research by asking the experience or perception or thoughts of a healthcare professionals who is working with you. So you are integrating the quantitative evidence with the qualitative evidence that will have more better result in terms of implementation. So that is what basically you need to think when you think of a mixed method research. So it's basically integrating a quantitative evidence with the qualitative evidence. It will be able to tell you so much of things. So there are multiple things which is lacking. I don't want to go to in each and everything. So always we have a over reliance of p-value, or we will be having the problems with the sample size. So that will be the problems of a quantitative evidence. So what we do here, as I mentioned, we'll be going for the qualitative evidence. So qualitative evidence, there are multiple methods of qualitative evidence. It's a huge topic. So maybe FCPI sessions will be discussing that in further future. Okay, so there are multiple methods of qualitative evidence. We have in-depth interviews. In-depth interviews where you will sit one-to-one with an expert. You will be talking with them. You will be getting their inputs. Then you will be converting that into the text. You will be analyzing it. Then you will be able to generate how that particular expert is thinking about your intervention. Okay, so then they have focused group discussion. In focused group discussion, what you will do, you will be sitting with a 10 to 15 experts, or maybe 6 to 7 experts at a time. You will be talking with them, you will be telling your ideas with them, they'll be sharing their thoughts, you will be getting those information, you'll be making the notes, field notes, you will be analyzing it. So there are multiple things in that. So then you have meta synthesis, where you will be analyzing like a meta-analysis. You will be analyzing the qualitative research, you will be generating the themes, sub-themes, ideas, and all those things. You have meta-ethnography, you have realist synthesis, you have qualitative content analysis. So there are multiple methods of qualitative evidence. So I don't want to more focus on that. So basically my concept in mixed method research is that you are combining a quantitative evidence with a qualitative evidence. So you can combine in different ways. Either you can combine a quantitative evidence first, then the qualitative evidence, but qualitative evidence first to the quantitative. So it's up to you, but depends on your context, depends on your need of study, depends on your research objectives. You can go with the multiple ways. Okay, so now I'll come to that in coming slides. Okay, so basically you have two designs. One is quantitative evidence, another one is qualitative evidence. So quantitative evidence, qualitative evidence decision making, as I mentioned already all these points to you. So it will be able to understand the participants feelings, opinions, their experience, how they feel about a specific setting, or you'll be able to deeply understand the different diversities in their voices, meanings, events, or you'll be able to understand the how suppose you are talking with a, it's like I said already an example of implementing a clinical pharmacy service. So when you talk with a physician, he'll have a different view. When you talk with a nurse, he'll have a different view. When you talk with any paramedic, he'll have a different view. So you are able to get a diversity in views. You'll be able to get a different views from multiple participants, and you will be able to collate that. So there are multiple advantages of having a qualitative evidence as well. So then you have a direct interaction with those people whom you are going to implement your plan. So it has so much advantage over the quantitative evidence. So basically, both qualitative evidence and quantitative evidence have its own advantages, but only thing is that you need to use it whenever it is required. Okay, so I'm coming to the mixed method research. As I already mentioned here, mixed method research is combining a quantitative evidence with the qualitative evidence. So how and when, that is more important. So you can't always mix a quantitative with qualitative without a proper justification. You should have a proper justification. So the way of doing a mixed method research is different in different aspects. Okay, so you have, as I mentioned, two aspects. One is quantitative evidence, another one is qualitative evidence. Okay, suppose here what I'm doing, I'm conducting both quantitative evidence and qualitative evidence together. If I say an example, I'm conducting a cohort study to understand how one drug is using. Okay. Meanwhile, along with that, what I'm doing, I'm conducting a qualitative research to understand what is the perception or experience of a physician about using that particular drug in the clinic. So what happens? You have a quantitative evidence, you have a qualitative evidence, and you are using this both together. So you are using this both together. So that design is called as convergent parallel design. Again, you have a quantitative research, you have a qualitative research, and you are doing it together at a time point, then that is called as convergent parallel design, mixed method research. So this will be able to tell you a broader understanding because it combines both quantitative and qualitative. So it will give a broader understanding of the research or your topic, or it will be able to tell you what barriers, because what happens with the quantitative evidence alone, you will not be able to get or understand what are the barriers in that particular intervention. So when you talk with a physician, he'll be able to tell that what are the barriers or enabling factors. Enabling factors means the factors which will ease your intervention. So that you may not get from the quantitative data. So basically, you will be able to get an in-depth concept that is the mixed method research of convergent parallel method. So here, even you can do something. Suppose you have a quantitative evidence, you have a qualitative evidence, you can compare them. So usually convergent parallel will be using whenever we are thinking of comparing the what clinical experience with the doctor's experience. So when we have both data, you can compare that. So that is the advantage of having a convergent parallel mixed method approach. So next method is sequential explanatory mixed method. Sequential explanatory mixed method research. So here what you are doing a quantitative design first, then you are going to do a qualitative. So it is not simultaneous. Okay. So in the convergent parallel, I'm saying that it is simultaneously you are doing. But in the sequential explanatory, you will be first doing a quantitative study. Then after completing the quantitative study, you will be doing the qualitative study. Why you are doing this? So why you are doing means you got a result, you want to know better insight, you want to know about my, like I said an example before, right? You are have an evidence to say that through the quantitative evidence, you have an evidence to say that your clinical intervention is effective, but you need to get it implemented in the practice, you need to get it implemented in the clinic. So you should get more broader understanding, more better insight from the physician, how it is going to happen them, how it is going to help them. So in that case, you are getting more insight, you are getting a better dissemination plan, you are getting a plan for your implementation of your particular intervention. So first you do a quantitative evidence, then you do a qualitative study. That is where sequential explanatory will come. This will help you to follow up with your intervention. This will help to have a better implementation plan. Next one is sequential exploratory. Sequential exploratory means here in this case, what you are doing a qualitative study first, then you are going to the quantitative evidence. So in the sequential explanatory, you are going to do a quantitative first, then qualitative, but sequential exploratory, you are going to do a qualitative first, then going for a quantitative. Why we are doing that? Okay, I'm going to conduct a research tomorrow, but I want to know, I'm not sure how can I conduct that research, or I'm not sure what data collection form I should use, or I'm not sure, like before I start my study, should I get something from a physician or should I get some information from a physician? So where you have lack of information to conduct your quantitative evidence, you can have a qualitative study first. You can get the inputs from the experts, you can get the input from the practicing physician, or you can get those who are involved, you can get the information from them. Then you plan your quantitative study. So that is what sequential exploratory means. I conduct a qualitative study first. for a better conduct of my quantitative research, so that you will be able to get more information. So to build your research, to build your quantitative evidence, or to build your implementation better way, you can go with the sequential exploratory. So these are the three methods. One is convergent parallel, then sequential explanatory, then sequential exploratory. So there is something more that is called as embedded or nested mixed method. So it's a symbol. I'm doing a RCT already. So what I do, both quantitative and qualitative, I will merge in the single study. Inside one study, I'll merge both quantitative and qualitative. That is called it as embedded or nested mixed method. Example, if I say one example, like I said, the same example which I said. So I'm conducting an RCT. So this RCT will have both two type of outcome. One outcome is quantitative. I'll have the clinical outcome, how my drug is affecting. Along with that, I'll be having some, as an example, you are doing a quality of life assessment, or you are doing something like a, uh, experience, how the experience, or you are doing a feasibility, or like whether your intervention is feasible to impart. So that case, you will be doing an embedded study or nested mixed method approach. So it will be more of understanding or exploring the feasibility of the intervention, or understanding the acceptability of intervention, and planning how you can do further on your intervention. So this is basically more applicable in policy making and implementation, because majority of the time, when you submit your regulatory documents after the drug or after the intervention, so they will ask you not only they'll ask you the clinical endpoint, they may be asking you the experience or perception. That's what usually we call it as humanistic outcome, what their experience is. So basically, it will help you to come up with the policy making and implementation plans. So that is the final part of a mixed method research. So these are basically four. There are more methods actually, but for a healthcare research, these are the four methods which we use. So it's basically help you to integrate the evidence. So you will integrate the quantitative evidence, then to the qualitative evidence, or you will be able to connect to the evidence, or you will be able to embed the evidence. So these are some procedures of mixing. So either you can integrate means you are uh, taking quantitative evidence, you have qualitative evidence separately, and you are integrating that. Or you can connect it. So you know, can connect means, like I said, one example, or first you made an approach that will be based on the second approach, that will be based on the, so I'm doing a quantitative evidence, but that quantitative evidence I'm doing based on my qualitative evidence. So that will be connecting the evidence. Embedding, as I mentioned, you will be embedding both evidence in a single study. So that is what basically the procedure of mixing the data. Then when you report a mixed method, there is so much of dilemma with respect to how to report a mixed method research. It's basically depends on your research question. You can report the mixed method research. There is no proper guide reporting guideline, I could say. There is no proper methodological guideline, I could say. But it depends on your research question, depends on how much volume of data you have, and obviously depends on the publication guideline of the journal. Because if it is a good journal, they will have the what I could say, word limitations. So obviously it may be difficult for you to get published that mixed method research in a journal which is having very limited wording. So you need to check out all those stuffs, then you need to write a paper. So when you write the paper, these are the major things which you need to concentrate on. First one is justification using for mixed method research. That is very important. As I mentioned, you can't always use a mixed method research. You should have proper justification why you adopted mixed method research in this research context. So that is very important. Next one is purpose, priority, and sequence of method. Like why you are using this method. As I mentioned, what is the purpose of using, whether it is just exploring the ideas, or as I mentioned, whether it is for an implementation plan or to develop a new research. What is the purpose of your developing a mixed method research. The priority means whether your quantitative research is having more priority than the qualitative research, or qualitative having more priority than the quantitative research, or what is the priority and how the sequence, whether you are going to do the quantitative first then qualitative, or qualitative first then quantitative. So all these things are very important. Then sampling, how you did the sampling, how you did the sampling for quantitative, how you did the sampling for qualitative, how you are going to collect the data, whether you are using any in-depth interview, or you are using any questionnaire, or how you are going to collect the data, how you are going to analyze the data, and how and who integrated the findings. It's not just integrating the finding. There should be a proper expert who can integrate the finding, because qualitative research, I have seen many times, majority of the people may not be able to develop a theme, or may not be able to integrate the evidence. So you should have a proper, you should mention in the article exactly who did the quantitative research, who did the qualitative research, how they integrated the qualitative research with the quantitative research. So all these things are very important. The limitation of the methodology, obviously, this, since it is unexplored area, there will be so much of limitations when you do the mixed method research. So you should discuss about the limitation. And finally, insight from the integrated evidence. It's not from what you got from the quantitative, it's not what you got from the qualitative, it's what you got from the mixed method research after integrating both. So that is more important. So these are all things should be discussed, should be reported. So that's how you report a mixed method research. So basically, these are the core consideration of doing a mixed method research: the rationale, why you want to do a mixed method research; the philosophical approach, whether you do qualitative first, quantitative first, then what method you are using, whether it is sequential, explanatory, exploratory, whatever it is. The skills you need, you should have both quantitative skill as well as the qualitative skill. It's not only quantitative, it's not only qualitative, you should have both skills. And if you are merging literature with that, you should have a literature evidence skills as well. Then project management, since it is a huge project, it's not only single project, it's multiple projects, so you should have a project manage capability. Then integrating aspect, like it's when you integrate different evidences, there will be multiple things, problems, issues, so you should be able to handle those things. Then demonstrating the rigor, so there will be multiple ethical consideration, there will be so much of other problems with that, so you should be able to properly uh, rigorously do that. Then you should be able to properly report the findings and disseminate the findings. So these are the some key guidelines which you can use for mixed method research, to report, to develop, to work on it. So these are some key guidelines. So with this, I would like to uh, stop my presentation, and thank you so much for attending this session. And if you have any queries further, either you can email to fcpiofficial@gmail.com, or you can directly email to me. So I'll be glad to respond to your queries. Thank you. Thank you so much, everyone. And over to you, Harida.
Thank you so much, Rashid sir, for this insightful session. Actually, in the comment box, we are having few queries. I think we can address that first, sir.
Perfect. Go
So,
ahead.
yes, sir. So the first question is, what are the common strategies for sampling in mixed method studies? Sampling size, like that kind of one question had come, sir.
Okay, so I'll answer one by one. So I'll answer this query first. That was a good question. So basically, it depends on your research. Like I said, an example, suppose you are mixing a cohort study with a qualitative evidence. Okay, cohort study, obviously you need to calculate your sample size according to your research question. Suppose multiplications are there, like z alpha z beta minus all square divided by standard equation. So there are multiple equations. So that will purely, it will be like, the quantitative study should have sample size calculation according to your research framework. Qualitative study should have a sample size calculation according to your research work. So both are separate entities. So calculate the sample size separately for quantitative design, calculate the sample size separately for the qualitative design. So if I say an example, quantitative studies, you know how to take the sample size. Qualitative evidence, usually if it is an in-depth interview, one-to-one interview, usually we take suppose 5 to 8, or 12 is the common number which we take on a thumb rule. It's not mandatory, but otherwise up to the saturation, we say data saturation. Data saturation means, okay, I plan to take 12 people, but what happens over the time after eighth or ninth person I interviewed, I understood that there is no more new data which is going to get from this particular qualitative research. So if that is the case, then it is called as uh, data saturation. So in that point, I will stop with 8 or 9. So it uh, depends on the situation. So basically, for a quantitative research, you should use the proper sampling size criteria. For a qualitative research, usually we keep 10 to 12 as a number, but as soon as you get a data saturation, you will stop there. So that is a sampling technique for a mixed method research. So basically, it depends on your research question.
Thank you so much, sir. I hope the query have been solved. So we will move on to the next query. What are the skills or training are necessary for researchers interested in conducting mixed method research? So
So
that is
as I
our next question.
mentioned, thank you. As I mentioned, the skills which you need is purely depends on how you are going to manage your research. So basically, if you are doing a quantitative design, suppose you are doing a cohort study, you should have all the skills a cohort study person should have or researcher should have. And if you are doing a qualitative research, so you should have a qualitative research skills. So again, it depends on your research. So basically, you should have a good research ethics. You should be able to enroll the participant. Your communication should be good because you are going to have a qualitative research, because one-to-one interaction, your communication should be very good, and you should be able to manage the multiple projects at a time. Suppose you are doing quantitative and qualitative together, converge and parallel, then you should have an ability to manage the multiple projects. So again, it depends. Suppose you are want to integrate the literature evidence, so you should have a evidence synthesis capacity, or else best way collaborate with the people, so those who are experts in that area, so then you can easily get through it. Yeah.
Thank you, sir. So to our next question, uh, how do funding bodies view this mixed method research compared to the other researchers? There are many types of researchers and funding bodies will have their own priorities. So according to each and every funding bodies, so how they are viewing this mixed method research?
So currently, if you ask me, mixed method is widely accepted, and it is one of the best method which you can adopt. So looking to the funding, if you ask me, frankly speaking, so funding is not depends on what type of methodology you use. Funding is depends on your objective, your rationale for conducting this trial, and the integrity of the methodology which you adopt. Okay, so suppose if in Indian setting, if I say one example, small example, okay, I want to implement something in clinical pharmacy. So obviously you need to adopt the mixed method research, because you should have a quantitative evidence to prove that that clinical intervention is effective. Along with that, you should conduct a pilot study, or should have a small qualitative research to prove that it is going to benefit the clinical setting. So then only you will be getting that funding through. So otherwise, it's need to be adopted, but not always. Depends on, again, research question. So obviously there is a good scope for funding if you return it properly, if you have a proper adopted methodology for that. Yeah.
Thank you so much, sir. So that was our last and final question. So I think we can conclude this session. So if anyone has any more queries, please mail to our FCPI official mail ID so that we can solve your queries. Thank you all. So we can conclude this session now. Sir had discussed all the fundamental points to go on with the mixed method research. Sir started this session with a simple definition on mixed method research. Sir had described the quantitative evidence, qualitative evidence, and literature evidence to be considered during conduction of the MMR study. Sir also explained when and how to work with the MMR and what are our advantages and disadvantages. Sir also mentioned all the methods which have been used for MMR. Sir also gave an overview on the procedures of mixing the data and what are the parameters we should keep in mind while reporting the findings. So thank you so much, sir, for giving this informational session to all of us. And I thank you all for your participation in today's session on mixed method research. So thank you all.
Thank you so much, Harida.
Yes, sir. Thank you, sir.